Good afternoon and welcome to our latest update. It's really important nowadays that everybody stay informed on the day-to-day activities that are going on, and we provide new updates and the latest medical information. Today you're going to be hearing from Supervisor Nathan Fletcher, who's going to be talking about food safety, and then Dr. Eric McDonald, our Medical Director in County Epidemiology and Immunization Branch, is going to be talking about our medical update. I want to thank San Diegans for being patient and following orders to stay at home and use social distancing. That's going to get harder and harder as we get further into this crisis, but it's the best way to slow down the spread of the virus and certainly flatten the curve. That's a term you're going to be hearing a lot about over the next few weeks and months. Let me emphasize that practicing social distancing doesn't mean shutting yourself off from the world. It's critical that you stay in touch with family and friends and see how they're doing. But we need to be smart and use technology. Call or email or do an online chat. Remember that old TV commercial that said, reach out and touch someone? Well, we want you to reach out. We just don't want you to touch anyone. With that, let's go to our speakers. We'll hear from Supervisor Fletcher about food safety and then get a medical update from Dr. McDonald.
Thank you. Good afternoon. We will jump right into our report. We'll go to the first slide. Yesterday evening, for an update on testing. What you'll see here is a drop of 770. In the county of San Diego. The next chart just shows the trajectory of kind of where we are relative to other jurisdictions, and I think that this is an important reminder for the public to really understand that we still in San Diego County are in the early stages of this. We did not have our first reported case until the second week of March, and so the efforts that we're taking around non-pharmacological interventions such as physical distancing, closing non-essential businesses and schools, we believe will have an effect. We clearly have community transmission, but in these early stages, just to reiterate how important that the actions we take today will help determine if we take a curve upward at the 50-ish day mark like other jurisdictions did, or if we can remain flat. And so we really want to reiterate to the public the importance of this. And then the last chart we have just really tracks the positive tests, the negative tests, the hospitalizations, ICUs, and the unfortunate loss of life. Fortunately for today, we have no additional loss of life to report, but we do expect all of these charts to continue to increase as we all fully commit ourselves to the efforts that we can individually take to try and address these issues. In addition to that, I want to update you on a very positive meeting that we had with all of the hospital CEOs for San Diego County. We've been in regular communication and contact with them going all the way back to January when this evolution started with our commitment to tackling the coronavirus outbreak. Our hospitals are the anchor. They are the foundation, the cornerstone to our response, and we are incredibly grateful for their hard work and their diligence. We're also incredibly grateful for their partnership and their collaboration. In an environment where traditionally one hospital may be a competitor to another, in this instance, they are all allies and partners working together. And we had an extensive call where we spent a lot of time talking about issues of personal protective equipment. We continue to fight to get as much as we possibly can from every available source, whether that is state request, federal request, buying things on the open and commercial market. And then we do our very best to provide that to the hospital systems based on the availability of what we have and the need of what they have requested. We continue to work and spend a lot of time today around some issues of standardization of usage of PPE, along with techniques to conserve personal protective equipment and a standardization of burn rate so that as we look 30, 60, and 90 days into the future, we can begin to make some best estimates and guidance around our ability to fulfill the request and our ability to go out and get more. Similar to PPE, we had a lengthy discussion around the issue of testing and the sharing of testing between hospitals. Some hospitals may have a greater capacity for testing than they have the actual need for, and so how we share that and how we prioritize that. And then we spent a fair amount of time with each hospital system talking about the incredible efforts that they are all making to increase their capacity. And so the things that they are doing to reimagine their facilities, to realign their own equipment and staffing, because that is really cornerstone to the effort to raise the bar. As we flatten the curve to slow the transmission rate so that those individuals who are positive, who need a hospital bed, an ICU bed, or a ventilator so they can do it, we help that effort in equal proportion by raising the bar of what is available and accessible. And so we appreciate each and every one of them. And then we spent a fair amount of time talking about modeling. It is a great challenge for every jurisdiction in an area where you have such uncertain data to try and model and project out different scenarios by what may happen. And we want to remain closely aligned with our healthcare systems as they are on the front lines and have great visibility into what they are seeing and doing. So we're incredibly grateful for all of our hospitals in San Diego County and for their partnership and their collaboration and frankly their leadership in these very, very difficult times. And we are incredibly grateful to their workers, the nurses, the doctors, the clinicians, all of the folks who show up every single day to protect us all, and we will continue to support them all. Second issue for today, you may have all seen reports about a grocery store and the impacts of the grocery store worker, and we just want to take a minute to kind of talk about food safety and food handling. In this instance, Albertsons Escondido had an employee who they reported tested positive. There was a little lag in reporting as jurisdictions. If an individual resides in a jurisdiction, then that is where that case is reported, and we're in close collaboration with all the surrounding jurisdictions. But if you have an individual who lives in one county and works in another county, that is really where the county-to-county communication is important. In the instance of the Albertsons Escondido, they did the right thing. They closed their store. They followed all of the sanitation protocols that are put in place, designed for a situation like this. And then they reopened, and we do not believe that there is any risk to the public at all in this facility or in other food handling facilities. It is really important to note that there is no evidence at all to suggest the transmission of COVID-19 associated with food. That is a CDC guidance, and we will continue to monitor and evaluate that. But it is important for the public to know that our sources of food are essential services. They must remain open. Because food is vital to everything that we do in a way of life. But I also want to emphasize that in addition to that CDC guidance, our County Department of Environmental Health runs an incredibly robust and very effective food safety program. They do that every single day of every single year, whether we are in the midst of a pandemic outbreak or not. In the outbreak of coronavirus, when we declared a state of emergency, they ramped up their efforts to be even more attuned to the needs of our food safety and the important role that that plays in our society. And they continue to work with food facilities to educate them, to make sure that they understand the public health orders, to make sure that they are moderating or modifying their operations to fully comply with them, and to ensure the safety of our food delivery systems in San Diego County. We have 15,000 permitted food facilities in the region. As a county, we have done outreach to them to see if they are operating, to answer questions, provide information on food safety practices, good food handler hygiene and sanitation processes. We also have a dedicated section of our website which focuses on information specifically for restaurants. This restaurant information has additionally been translated into 7 different languages to ensure that it is available to all of the restaurants throughout San Diego County. The environmental health and public health have an established process we follow when we are notified of a sick food handler with the reportable disease. And it's really important that we get the word out and remind all restaurants, all grocery stores, everyone involved in food preparation, that if you have a sick worker, they must stay home. State law and the California Retail Food Code requires the person in charge to send home any staff who is ill. But in addition to that, we need any food handling location, a restaurant, a grocery store, any others, to contact environmental health as soon as possible if you have an instance of a sick food handler. You can contact our epidemiology liaison at 858-505-6814, or you can email FHDEPI at sdcounty.ca.gov. Again, that's FHDEPI at sdcounty.ca.gov. In addition to these efforts and actions, we have and are increasing our outreach and inspection processes in the coming week to be in the field to ensure full compliance, to have more inspectors out, sharing more information, providing more information. But at this time, we have full safety and confidence in the integrity of our food safety system throughout San Diego County. And with that update, I will pass it to Dr. Eric McDonald.
Thank you, Supervisor Fletcher. Just as the supervisor mentioned, we have had 488 positive cases for COVID-19 in San Diego County residents reported so far. Of these 488 cases, 305 or 63% are between the ages of 20 and 49, 206 or 42% are female, 57% are male, 96 or 20% of the cases have been hospitalized, and 42 or 9% have been admitted to the intensive care unit. Unfortunately, 7 or 1% of the total number have died, and the age range of the individuals who have died goes from 25 to 87. I won't be giving any specific updates on clusters. There are no changes in terms of the number of groups of cases that we are investigating, either in nursing homes or other fixed facilities. And I did want to make a couple of comments, as the supervisor mentioned, about test results. Maybe you can go back to that slide if it's possible to do that. There you go. You might notice that on the 27th, the number of tests went down, and it's important to know that the test results come to us from different sources in a batched manner, usually at the end of the day. Much of that is by paper and fax. Much of it is electronic. The major commercial laboratories, Quest, LabCorp, and AirUp, actually report electronically through a system that the state uses. And that system goes down for maintenance on the weekends. So we expect for today and perhaps into tomorrow and even the next day that the numbers will go down simply as a result of the maintenance on the electronic feed for negative results. We would anticipate, though, those would be batched together again when that is fixed. We routinely report, for example, on influenza. And we actually have this happen with our influenza stats, but because we only report influenza once a week, this difference day to day on electronic batching doesn't really show up. And I don't want people to interpret this as an indication of, number one, ongoing testing, nor whether testing day to day is really going up or down. So I think that's important to point out. The other thing that's important to point out in terms of context is that on our website, we actually do produce a list of cases by city. And we do that because it's easy for people to understand in a jurisdiction and follow how many cases are in my area. But it can be very misleading to interpret those results as indicative of the risk in a specific area and really what the true scope of the epidemic might be. Just because somebody lives in a place doesn't mean that's where they were exposed. Many of our cases, in fact, were exposed outside the county. And so we've had, in fact, cases who've been exposed, who were cared for and actually hospitalized outside the county in their entire episode, but yet are counted in a jurisdiction in San Diego because that's how we just do the counting. So it is very important to know that you should not interpret day-to-day changes in the numbers by city as indicative of risk, or comparing one city to another as indicating any risk in one area versus another. The best advice is to follow the governor's and our local public health officers' advice that there is essentially community-wide transmission and the precautions that you should take, which is to stay home as much as possible, to certainly self-isolate if you have any symptoms, and really only go out for essential functions and tasks, applies really wherever you are in the county of San Diego. So please don't take either a sense of false security or a false sense of alarm from looking at the listing city by city. Lastly, I would like to give an update on the cruise ship situation. We do have a cruise ship, the Celebrity Eclipse, which will be docking tomorrow in the county, and we have been working closely with the port, the local CDC quarantine station, the CDC Cruise Ship Task Force, the Coast Guard, the Customs and Border Patrol, California OES, and other organizations to ensure that when this ship docks, they will be a safe and timely disembarkation of the 1,500 passengers over a 24 to 40-hour period of these individuals to be able to leave the ship and go to their respective homes across the country. The health of the ship is excellent right now. We've been in daily communication with the medical department and the leadership on the ship and the cruise line, and we are following day to day any reports of illness. And at this time, the plan is to have those individuals screened for symptoms, have their temperatures taken, and they will be disembarking with plans to go straight to their homes of record. We know that 17 of those individuals, at least, are San Diego County residents. We're waiting for a full manifest from the ship company to be sure that there aren't any more. But we, in fact, will know that those 17 individuals locally, as well as the other 1,500 individuals, will complete 14 days of quarantine when they get to their homes, as is recommended standardly by the CDC for anyone who's coming from international waters on a cruise ship. And those are my updates, and I'll be available for questions later. I'll turn it over to the supervisor.
Okay, we're going to go directly to the question. We have 3 call-ins. Again, if your name and outlet is not identified in the introduction, please do so. Let's go to the first question.
NBC 7, please state your name and question.
Erica Cervantes from NBC 7. I know there's no update on the amount of cases at assisted living facilities, but for people, for medical workers that have visited those facilities under investigation, should they be self-quarantining?
Okay, we'll ask Dr. McDonald to answer that.
That's an excellent question, and kind of gets to when a specific area has a specific individual who's been identified, and a release might go out to the public saying, an ill person worked here, here are the precautions that we've taken, and this is to let you know that we have done these actions. It's important to know that we in the health department identify close contacts of individuals who may be at risk for transmission, and those individuals are identified and notified for self-quarantine, and they monitor themselves for symptoms. The general public does not need to do anything more than what we're already saying, which is to monitor your health, stay home, and if you develop symptoms, certainly stay isolated and access medical care if needed. Our messaging in the public health department, it's important to know, is for a specific location in which a case has been identified to see if there's extra action that the public should take as a result of that notification. And we're giving the same advice to everyone across the county right now to follow these important health officer orders and recommendations. And so there's no extra step that needs to be taken beyond being identified specifically as a close contact, and those individuals know who they are.
Thank you.
Okay, next question.
iNews Source, please state your name and question.
Hi, this is Brad Racino, News Source. So, as you know, the CDC has labeled certain populations at higher risk than others for developing COVID-19 related complications. Those populations include seniors 65 and older, people with heart disease, diabetes, COPD, obesity, and asthma, as well as the immunocompromised. My question is the county using any data from the CDC or Census Bureau to determine where the highest concentrations of these at-risk populations currently live in the county to possibly better allocate resources or do some kind of targeted outreach?
Okay, Dr. McDonald.
Thank you for that question. Actually, if you go to our Public Health Services website and look under Community Health Statistics, there's actually a wealth of information by region, HHSA region of the county, that describes both the age demographics and the health demographics of those areas. The message, though, for everyone in the county is the same, which is if you're in the specific groups that you mentioned, you are at risk. And we are certainly working with organizations and agencies that deal with groups at risk, whether it's skilled nursing facilities, whether it's our aging and independent services, outreaching to older San Diegans to make sure that tailored messages are going to them. But really, you outline beautifully the specific people who are at risk. And so if you're listening to this and you're in one of those groups, you should take extra precautions and be sure that you are very aware of your essential activities, and even within your own family unit, to be aware of your interactions to be sure that you're lowering your risk.
Okay, we have one more call-in question, and then we'll take the text questions.
Channel
ahead.
10, please state your name and question.
Hi, Vanessa Van Hefty, Channel 10. On the Disney cruise ship that came into San Diego last week, we know that there was one crew member on board that tested positive. Could you clarify why the passengers, why they were let go, why they were not required to stay on the ship?
Okay, Dr. McDonald
With
will
that
also deal with that
positive case?
question.
Sure. At the time that the Disney Wonder came into port, there had been no identified COVID cases on board. And the individuals who were on the ship actually were screened for health before they left and given 14 days of recommended quarantine as per CDC when they reached their homes. Since the time of the disembarkation, there has been identified one passenger with COVID who developed symptoms and was seen for health care after leaving the ship, and one crew member who's been identified. And again, that's why we continue to monitor these groups after they've disembarked. The key was that these individuals were safer at home than they were on the ship, and the transportation of those individuals to their home did not put the public at any greater risk from exposure than already exists in the community.
So the passenger and the crew member were diagnosed after people had already been let off the ship.
That is correct. That is correct.
And so you're continuing to monitor them at this point, knowing that information?
Well, we continue to monitor individuals who are still in San Diego County who were from that ship, and we are also monitoring the crew members who remain on that ship to be sure that no significant symptoms concerning for COVID develop.
Okay, we're going to go to the text questions. I know the first question or two questions is really directed towards food service and food safety. And we're going to call up Amy Harbert, who is the Assistant Director of the Department of Environmental Health, to answer those questions.
I'm going to read two questions together here because they're interrelated. Sarah Cohen from ABC 10 News. Yesterday, we confirmed 3 grocery workers at different stores across the county tested positive for COVID-19. One of those stores is in the Albertsons in Escondido on West Valley Parkway. We were at that location yesterday afternoon, and there was no signage or other message alerting customers that an employee had tested positive for COVID-19. What responsibility, if any, do grocery stores have to notify customers of known positive cases in their stores during this pandemic? And then the second question that was related, Mario Escovedo, News 8. Yesterday, Albertsons confirmed a COVID-19 case for a worker in Escondido. Are there any other cases at local grocery chains, and how are you handling those cases? Also, do you have numbers of COVID-19 patients who have recovered in San Diego?
Yes, we have had COVID cases that are associated with food facilities, as you heard earlier. In these instances, our food facilities have done the right thing. They have self-closed, they have followed sanitation and disinfection protocols, and then they reopen when it's been safe to the public. And there's no ongoing risk at these facilities. This is an important reminder to all of us who are essential workers, no matter our industry. If you are ill, please do not work. And please practice social distancing for all members of the public who are in our grocery stores and markets. It's important to follow the protocols of washing your hands. Remember food safety, to wash your produce when you get home. Practice social distancing, and that will help all of us to help to mitigate. I can turn it over to Dr. McDonald in regards to the EPI case investigation.
Can you remind me of the second half of that question again? There was a second half that was for me. I apologize.
There was are there any other cases at local grocery chains, and how are you handling those cases? There was also just, do you have numbers on COVID-19 patients who have recovered in San Diego?
Right.
Is that
The
part?
recovery question was the one I was looking for. We still have not posted in terms of numbers of cases, those who are recovered. That is something we will do a little bit later on when we have good follow-up on those cases. There's differing definitions of what recovery means. Some of that involves testing, some of it involves symptom resolution, and really until that's adjudicated really across the country, I think it's premature to be reporting on that. There have been a total of 5 food handler cases that are in the COVID statistics that I've mentioned. 4 of them involve, of San Diego residents. 4 of them involve employees at restaurants, one of whom involves an employee at a grocery store. And again, just as we did with our previous outbreak here in San Diego of hepatitis A, when we identified a number of food handlers, the indication to let the public know is when there are actions to take that are different than what we're already recommending. And in all of these cases, there is no difference in what the actions of the public should be, which is to stay home as much as possible. If you develop symptoms, to then stay home and access care and the advice that we've in fact already given. So I hope that answers the question.
And just to clarify, the grocery store would have an obligation to notify the county. I believe the next 2 questions are directed towards Dr. McDonald, so I'll ask him to come back up.
Mike Freeman from San Diego Union Tribune asks, have colleagues of the Albertsons employee who tested positive been tested?
That's a great question. What we do when we learn of one of these cases is to look at close contacts and colleagues and determine if any are symptomatic. Individuals who are not symptomatic do not need to be tested. Individuals who are symptomatic need to go home and self-isolate, and in some instances need to be tested. There are no tests pending and no ill contacts at this time for this particular case. And the second question is? Sorry.
E-cigarettes, I'm sorry, this is from Gina Yarborough of San Diego County News. E-cigarettes or vaping has caused severe lung illness among users. Given the severity of COVID-19, would you consider vapors in the high-risk category of suffering severe respiratory tract infections from this virus?
I think that's an excellent question. Really, any lung disease or any lung condition would put you at risk for a bad outcome from any respiratory illness, flu or COVID-19, and specifically anybody who is a smoker, a vapor, a hookah user, really putting anything into your lungs that wasn't intended to be there in the first place, that can put you at increased risk for respiratory illness. We don't have a specific case amongst those that we have identified thus far that looks like it's linked specifically only to vaping. However, I would give a strong recommendation to anyone who's using tobacco products or vaping that they should use this opportunity to quit. There are great resources available on the 211 website to access to be able to do so. But I would say that absolutely vaping and other tobacco use products would put you at increased risk for a poor outcome from a respiratory illness.
Okay, I believe that completes our call-ins and our text questions. Just in closing, throughout this very difficult time, we've been highlighting the good work that's been done by a lot of the citizens throughout San Diego County and organizations. And I want to shine the spotlight today on the San Diego Food Bank. In partnership with the San Diego and Imperial Counties Labor Council, they passed out food to 1,000 needy individuals yesterday. And they're hoping to do more food distributions, and we really want to thank them for their effort. They're part of a great team effort that we have throughout the San Diego County region to help people during this very difficult time. Let me remind you that if you need to get more information or need to find more resources, we want you to please visit our COVID-19 website at coronavirus-sd.com. And if you need to talk to someone and ask a question, then call 211. And remember, San Diego, live well, and stay home. Thank you for attending today and listening, and we'll see you tomorrow at 2:30. Thank you.